All right, today we're going to talk about something that can feel a lot like a common illness, but it's a whole different ballgame. We're talking about pneumonia. Let's dig into what makes this so much more than just a bad cold. You know the feeling, right? You've got a fever, this cough that just won't quit, and you feel kind of breathless. It's so easy to just write it off, you know? It's just a nasty cold or maybe the flu. But what if it's actually a signal that something much more serious is brewing deep inside your lungs? So, yeah, that's exactly where we're going to start. Because to really get a handle on this, we have to understand why pneumonia is in a whole different league from your average everyday cough or cold. This is one of those things you absolutely do not want to ignore. Seriously. Why? Because even though the symptoms might seem pretty standard, what's happening under the surface can get dangerous. Fast. We're talking life-threatening in just a matter of days if it's not caught. So to really understand that risk, we've got to take a look at what's going on deep inside the lungs.
Okay, so let's get into the nitty-gritty. What exactly is pneumonia on a physical level? What's happening when those nasty germs manage to sneak past all your body's defenses and set up shop deep inside? So here's the deal. Pneumonia is an infection that goes way down into the most delicate parts of your lungs. We're talking about the millions of tiny little air sacs, the ones that do all the heavy lifting of getting oxygen into your body. When germs get in there, things get inflamed and those little sacs start to fill up with fluid and gunk. And that's the core problem. Which should be full of air is now full of liquid.
It all happens in a few steps. First, the germs get in. Simple enough. Then, of course, your immune system rushes in to fight back. It's like a war zone in there. But that battle creates inflammation, and that's what causes those air sacs to fill up with fluid and pus. And here's the absolute key takeaway. All that gunk creates a physical roadblock. It literally blocks your lungs from doing their number one job, which is moving oxygen from the air you breathe into your blood. I love this analogy. It's perfect. Imagine your lungs are like a big, fluffy sponge. When they're healthy, they're light and airy, and they can easily soak up all the air you need. But with pneumonia, that sponge gets completely waterlogged. It's heavy, it's dense, and it just can't soak up any more air. And that right there, that is why you feel so out of breath. Your body just isn't getting the oxygen it needs. Okay, so we know what's going on inside, but how does that actually look and feel on the outside? What are the telltale signs that we really need to be on the lookout for?
What's really interesting is that pneumonia doesn't always show up the same way. It can have two totally different personalities. On one hand, you've got what we call typical pneumonia. Bam, it hits you like a truck. High fever, a really productive cough, sharp pain in your chest. But then there's this other version, the atypical kind. And this one is way sneakier. It can creep up on you with just a low fever, a dry cough, maybe some headaches. You just feel kind of blah. It's so much easier to mistake that one for something minor.
So, spotting those signs is step one. But what happens next? How do doctors actually confirm it and figure out the best way to treat it? Let's take a look at their playbook. Well, doctors have a few go-to methods. First, they'll just listen to your chest. They're listening for this very specific crackling sound that screams fluid in the lungs. But the real confirmation, the gold standard, is a chest x-ray. That lets them literally see the problem, that waterlogged patch in the lung. And sometimes they'll run lab tests on your blood or what you're coughing up to pinpoint the exact germ that's causing all the chaos. All right, so the doctor confirms it. It's pneumonia. Now what? Because not every case is created equal, right? How do they decide if you can just go home with some pills or if you actually need to be admitted to the hospital? They actually use a really smart checklist to gauge the risk. They look at a few key things. Are you confused? Is your breathing really fast? Is your blood pressure low? And how old are you? By checking off these factors, they can get a quick score that tells them just how serious the infection is. It's a super practical way to figure out the right level of care. And that score directly leads to the treatment plan. It's pretty straightforward. If it's a mild case, you'll probably just head home with some antibiotic pills. If it's more moderate, you're likely looking at a hospital stay with IV antibiotics to hit the infection harder. And for the most severe cases, it's straight to the ICU. That's where they can bring out the big guns, really powerful drugs and crucial oxygen support to help you breathe. So really, the whole goal of treatment is a two-pronged attack. You have to fight the infection, obviously, with things like antibiotics. But at the same time, and this is just as important, you have to support the body. You have to help it breathe while the lungs are basically out of commission and working on healing. Wow, okay, we have covered a lot of ground here. from what's happening inside the lungs all the way to how doctors fight back. So let's boil it all down to the absolute must-know points. If you walk away with anything today, I want it to be these three things. Number one, that combination of fever, cough, and shortness of breath, that's a huge red flag. Never, ever ignore it. Number two, remember what's actually happening. This isn't just a cough, it's an infection inside your lungs that's physically blocking oxygen. And finally, number three, this is not something to self-diagnose. You need a doctor to figure out how serious it is and decide whether you can be treated at home or if you need the hospital. It's absolutely crucial. So that really leaves us with one final thought. Now that you know what to look for, could you spot the signs when it really, truly matters? Because understanding this stuff isn't just for trivia night, right? It's real-world, practical knowledge that could make all the difference for you or someone you care about. The most important thing is just to listen to your body and know when that simple cough might be signaling something much bigger.